and we'll let you move on to your next bill. Thank you. We still have quite a few members who haven't come.
Thank you, Mr. Chair and members. Next bill that I will be presenting on is SB 1010. Members, the fact that we require individuals to purchase health coverage creates a moral obligation to do everything we can to ensure that this product and what we're providing them is affordable. There has been much talk over the past couple of years about new and innovative drugs which are vital to our healthcare system, and I don't doubt that they are, but that have been introduced to the market with incredible prices. In fact, Medi-Cal is planning to pay close to $1 billion to health plans next year to help cure one particular disease. $1 billion for one drug. That's why I've introduced this bill, SB 1010, which requires drug companies to give advance notice to purchasers when prices increase by more than 10% or when a new drug cost is more than $10,000. This bill also provides consumers a greater understanding of their share of drug costs by requiring health plans to identify the drugs that are driving up the premium cost. Transparency in the healthcare marketplace has always been a priority of mine for the entire time I've been here. As a matter of fact, I had a bill I ran earlier in a different committee dealing with transparency for providers and an all-payers database. Transparency focuses policies passed by the legislature include requiring hospitals to provide pricing information for common surgeries, health plans to submit detailed data on premium increases, and doctors report more information to the federal government. To date, drug makers have escaped this openness. Earlier this year, I started a dialogue with a number of stakeholders, including the supporters as well as the opponents of this bill. As those of you who work with me, this is something that I'm always trying to do to make sure that there's plenty of transparency, more importantly, a dialogue between all of us. I did have some very productive meetings with a larger number of folks, many of whom came to support the bill. I also met numerous times with the drug companies, and I'd hoped that we could work together, but with some exception to generic drug manufacturer, in general, the industry has not provided any sort of tangible solutions to the problem that we're facing today. And I'm still open to that dialogue and still willing to have that conversation, maybe to talk about, value. Instead, we get arguments like the most recent op-eds in the San Jose Mercury News, which claim that this bill is going to kill people. Well, really, it's not going to kill people. The industry says that their drugs cost so much because of research and development. Well, I would argue that when you look at research and development, 50% of the money that's paid for research and development in this country is paid for by the federal government or by the university systems. But yet, for every dollar spent on research and development by the opposition, there's $19 in marketing. Marketing directly to the consumer. So I would say that they're doing pretty well, and I don't think that they shouldn't be making a profit. Everybody should, and yes, they should recover their costs. But we have a real sensitive issue here because we have to make sure that the consumer gets a good price. And don't forget that this one is the most, as I mentioned, the most profitable industries out there. The sergeants have passed out a mock-up of the summary of amends. Now keep in mind that I've had conversations with members, and I want to take this opportunity to thank each and every one of you, with the exception of Assemblymember McCarthy, because I know he was just appointed to this committee at the last minute. I know I haven't had a chance to talk to you, so I'm saying up to this point I've been able to meet with most of you, my schedule allowing, and I've heard concerns, and the concerns have come from you. So what I've been trying to do is to address all of those concerns to you individually to see if I can get you to have that conversation with me. So the concerns I've heard and the amendments that were proposed to take is to decrease the notice for drug price increases from 60 days to 30 days. To clarify the definition of a generic drug. To add language to require health plans to report the use of the pharmacy benefit managers. I heard this from many of you. To require the PBMs to notify clients of their price increase. To clarify the drug manufacturers only have to notify current purchasers of a drug if there is a price increase for a drug. And to delete the annual legislative hearing on drug price increases. Because I heard there's too much government involved. So I am painstakingly trying to address as many of the concerns as I possibly can from the members. I want to just close by saying that this bill will bring prescription drugs in line with other sectors of the healthcare market by shining light on. And I'm not here to tell you that I would ever advocate on price fixing. But if you look at what's happening nationally, Vermont was the first state to actually pass a bill very similar and has probably more teeth than this bill. There's several other states that have pending legislation. This conversation has to be had because, as I said in my opening statements, we're requiring the consumer to buy this. It's our responsibility to make sure that they have a fair price. And yes, let's let individuals make profits as well. And yes, it's even in the presidential debate. There will be, and there should be a discussion on this topic. And California being the size of the state that it is, that if this bill comes out and if the governor signs it, we can continue this conversation on a national level. We can be proud of the fact that we move major pieces of legislation forward. Members, I do have some individuals that would like to speak in support of the bill. And before I close with my opening, that is, I want to thank all of you who've taken the time to meet with me personally in your office, whether we agree or disagree, but I appreciate the dialogue we've had. And I'm still always open to continue that dialogue. Thank you.
Thank you. Witnesses in support, you can have up to 6 minutes, and you can divide it however you see fit.
Thank you, Mr. Chair. Mr. Chair and members, Sarah Flocks from the California Labor Federation. We are a proud co-sponsor of this bill. Would like to thank our author for all the work he's done. We're here as the co-sponsors because our affiliates negotiate and purchase health benefits for over 2 million union members and their families in the state of California. And we have trust funds that are paying $14 an hour per member just for health benefits. That's on top of the wages. That's $14 that is coming out of our members' pockets that is going to health coverage. And over 20% of that is going to prescription drugs. And you're going to hear from the opponents when they come up here that prescription drug pricing is very complicated, there's lots of middlemen, there's this whole process. But in the end, it's actually quite simple. Workers, employers, taxpayers, we are the ones who are ultimately paying for prescription drugs, whether it's at the pharmacy or whether it's through our premiums and cost sharing. And at the other end, pharmaceutical companies are the ones who set the price of the drug and increase the price of the drug and profit from the price of the drug. When a pharmaceutical company decides to raise the price of a drug, they get to tell their shareholders that they have a fiduciary responsibility to, that this is going to improve their stock price, it is going to improve their dividends to shareholders, and they're going to tell them that because they have a responsibility to shareholders. For us, when the price of a drug goes up, it means that we have to go to our members and we have to say, you're going to have to reach into your pockets again. You're going to have to give up that raise, you're going to have to give up more money in your benefits, and you're going to have to get by on less. That's what it means when drug prices go up for us. And just to be clear, we are willing to pay, and we have to pay for life-saving drugs for our members. And we will do that, but what we can't tolerate is arbitrary and unjustified price increases that hit us close to home. And so I wanted to speak really quickly about transparency, because there's been talk of this bill as transparency, advance notice, disclosure. Our trust funds have done a really great job using transparency as a tool internally to drive down costs. We have members here from Unite Here, hotel workers, casino workers. Their union has done an incredible job doing disease management, targeting members that have diabetes, asthma, hypertension, and making sure that they do drug adherence, making sure they take those drugs because it saves us costs from them going to the emergency room. I would think drug companies would be happy with us. We're making sure members take their drugs because it saves money in the long term. But when you see insulin drugs going up 347% when they've been around since 1950, with no explanation and our members not getting 347% healthier, it hits us because we have to pay for that. And so this bill is simple. It says, give us advance notice. Give us 30 days advance notice so that we can negotiate, so that we can prepare our budgets when we see the increase coming, so we can change our formularies, or so we can find alternatives. That is simply what this bill does. In the end, we, the public, are the ones who pay. Pharmaceutical companies are making the decision to increase prices. All we ask is for some advance notice. Thank you.
Beth Capel on behalf of Health Access California. We're pleased to be here as a co-sponsor along with the many other organizations in support who represent a broad range of purchasers, whether it's our co-sponsor, the California Labor Federation, or the many business organizations that are also in support. Notice and disclosure are what we do in healthcare to try and control costs. The examples of advance notice include PERS, which a few weeks ago announced its rates for 2017. Covered California, which has already announced what the copays and deductibles will be for 2017 and which next month will announce their premiums. As you just heard on SB 908, other purchasers get 60 days notice of when their rates are going to go up for the next year. When a hospital wants to terminate a contract with a health plan, it has to give 75 days notice. These are just a few examples of the many instances in which advance notice is given in healthcare as a means of allowing purchasers time to adapt and to negotiate with those whose prices are increasing. Similarly, we have numerous examples of disclosure. Since 1982, hospitals have disclosed in detail their costs, their revenues. This has not led to price controls, as some fear. If it's a slippery slope, it's a rather slow one. It's more than 30 years since we started disclosing costs for hospitals. Health plans have to do rate review. You just heard about that. The list goes on and on about disclosure of costs. Two more points. Senator Hernandez mentioned that we currently require both individuals and employers to purchase health coverage. In addition, we require health plans to cover not just life-saving drugs, but any medically necessary drug. This inherently limits their ability to bargain. In that context, notice and disclosure information is an important corrective in order to allow for the market to function. For those reasons, we're pleased to be in support of this measure.
Mr. Chairman and members, my name is Jack Ribbon. I'll be very, very brief. I realize you have a lot going on here. But I represent Unite Here, the Hotel and Casino Workers Union in California. And to make our point today about how grateful we are to Senator Hernandez for authoring this bill and how grateful we will be to every one of you who will support this bill. We have 300 of our leaders from all over the state of California, from all over the state, from all the way down to the southern part of San Diego and then all the way up north, to say to you who will support our bill, Senator Hernandez bill, thank you. We need this to control our costs and to help persuade those of you that may be concerned about issues that the senator has brought up, that he's working on with other people, that, you know, the senator's certainly the right guy to do that. So please vote yes on this bill. It's a very, very important part of our ability to control our costs.
Thank you. Further witnesses in support, name and organization only, please.
Barry Broad on behalf of the Teamsters. Thank you.
Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Michelle Cabrera with SEIU California in support.
Emily Rush with CalPERG in support.
Stuart Ferry with the National Multiple Sclerosis Society in support.
Ray Nix, California Alliance and Retired Americans, strong support.
Robert Coleman from Disability Organizing Group for Initiative Total Equality and Support.
Autumn Ogden with the American Cancer Society Cancer Action Network in support.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance in support.
John Winger on behalf of America's Health Insurance Plans and Anthem Blue Cross in support.
Derek Lennox on behalf of the School Employers Association of California and Small School Districts Association in support.
Pat Whalen, Ellison Wilson Advocacy, here on behalf of UNAC, that's United Nurses Association of California, Union of Healthcare Professionals, a proud member of ASME. Urge your support.
Nick Luizos, California Association of Health Plans in support.
Teresa Stark, Kaiser Permanente, strong support.
Reese Tonneson on behalf of AARP in support.
Stephanie Roberson on behalf of the 90,000 nurses in the state of California in strong support.
Allison Ramey with Blue Shield of California in strong support.
Michelle Orrock with Molina Healthcare of California in support.
Rand Martin on behalf of AIDS Healthcare Foundation in support.
Fred Main on behalf of Cigna Life and Health Insurance in support.
Brian Warren on behalf of the California Pharmacists Association in support, and just like to briefly note that we appreciate the recent amendments to provide transparency to pharmacy benefit managers. That's a step in the right direction, and we'd like to see future legislation to further that goal.
Thank you, Mr. Chair. Members, Megan Brightwell on behalf of the California Professional Firefighters in support.
Libby Sanchez on behalf of Laborers Local 777 and 792 and the Orange County Professional Firefighters Association Local 3631, all in support.
Scott Wetch on behalf of the California Association of Electrical Workers, the California Coalition of Utility Employees, the California State Pipe Trades Council, the Western States Council of Sheet Metal Workers, and the Elevator Constructors Union. Thank you.
Dan Chick with HealthNet in support.
Araceli Argueta with Unite Here Local 11 from Los Angeles in support.
Hugo Soto with the Hotel Workers Union, Unite Here Local 11 in Los Angeles in support.
Sergio Sorza, Local 11, Unite Here in support.
Rosalba Mata from Local 11, Los Angeles in support.
Paula Abad from Unite Here Local 11 Los Angeles in support.
Edelmira Ulloa in Local 11, I'm here to support.
Alma Romero, Unite Here, I support. Morena Diaz, Local 11, Los Angeles, I support.
Romelia Rojas, Unite Here, IU in full support.
Lydia D'Angelo with 2850 in support.
Lucy from Unite Here 2850 in strong support.
Hi, I'm Talia Mir Malik with Unite Here in strong support for SB 1010.
Ben Hadley, Unite Here, strong support.
Michelle Flores, Unite Here intern, full support.
Mario Yedidia, Unite Here, strong support.
Dennis Perry, Local 49, strong support.
Michael Rogar from Unite Here 49.
Chris Rack, President, Unite Here Local 49 in Sacramento in strong support.
Hazel Rack, Unite Here Volunteer, strong support.
Jason Mendez, Unite Here Local 11 in Los Angeles, strong support.
Dolores Duran Flores with the California School Employees Association in support.
Any further witnesses in support? Seeing none, witnesses in opposition? And I gave an extra minute, so you are entitled to an extra minute. You do not have to use it, but it's being extended to you.
Thank you, Mr. Chair, members. My name is Fred Noteware, represent Pharma, and we are opposed to the bill. And while we understand the amendments were offered to try to move the ball forward a bit, we still remain opposed as we've reviewed these amendments. We want to thank the author and his staff in particular for being available to us and for their interest in this issue and the open dialogue that we've had. But real quickly, let me just go through the bill as we see it. We believe this bill doesn't solve any real problems. We don't think this will do anything to reduce the cost of drugs. And it will put unnecessary and onerous reporting requirements on companies doing research and development on new innovative drug therapies and cures. And it does not, in our opinion, provide any transparency or justification on what health plans are doing that make patients' out-of-pocket costs increase. It doesn't provide any real insight on what pharmacy benefit managers are doing with the rebates and discounts they've negotiated with drug manufacturers. And the question really has to be asked, are these discounts being passed along to patients or even, for that matter, health plans? And this is the kind of thing we think could be displayed in the aggregate. Our biggest concern, and I think the committee knows this well, is the requirement in the bill for an advanced notification of a price increase. The prior version of the bill had a 60-day notification for existing drug. We understand that's now going to be amended to 30 days. The bill still has a 3-day notification on a new drug. And it's our view that the real issue is the notification itself, and as a practical matter, the number of days, while significant, it's the underlying issue of the notification itself, because in our opinion, this will drive up demand because, consistent with basic economics, when a purchaser knows a commodity's price is going to go up, they're going to want to buy more of that product. Any increase in demand can create a shortage, and that's the concern we have for patients. There's not an inexhaustible supply of drugs at any given time, and frankly, for that matter, especially for those products used for more rare diseases. In addition, a drug company provides notice of a price increase by virtue of reporting requirement in this bill. The entire country will know. This bill will have national implications since the notification will not be limited to California-only purchasers. And Mr. Chair, members, I know others here will want to speak to this, and again, we appreciate the good faith efforts of the sponsors and the author, but we believe prescription drugs, while they cost a lot of money to bring to the market, do provide value to the healthcare systems. Our products cure the sick and allow others to have a quality of life while living with chronic conditions. And ours is the only component of the healthcare system where prices actually go down over time. And we will gladly compare our value proposition to others in the healthcare system. With that, I'd be happy to respond to questions, and thank you.
Good afternoon, Mr. Chairman, members. Mike Carpenter on behalf of CLSA, representing more than 750 members of the life sciences industry. Our sector's 275,000 California workers research, develop, and produce treatments that save and improve human lives across the globe. We share the author's concerns about access and affordability, but we oppose this bill because we believe it seeks selective information that won't meaningfully inform the healthcare cost dialogue or help patients. Specifically, we think that this bill would provide a distorted picture of the role that medicines play in overall healthcare costs, would create an incomplete and therefore inaccurate price reporting system that would actually obscure the actual price paid for medicines, would still require the disclosure of proprietary information, would treat parties affected by the bill unequally, would create market disruptions that could impede patient access to medications, and in some instances, drive up prices. So, our threshold objection is that the one-sided information required by the bill creates a highly inaccurate picture of the role that medicines play in reducing overall costs and helping patients and society. We've just heard the proponents talk exclusively about costs, but you can't just look at costs without also looking at benefits, at offsets, and it decreases in prices and costs. For example, just looking at the value of health enhancements, the survival gains of cancer patients alone have been found to be worth more than $2 trillion to our society. The bill also, as Mr. Noteware touched on, doesn't account for any of the costly medical care avoided by medicines, the cost savings in ER visits, physician office visits, and hospitalizations saved by the use of medications, or the number of people who can work because of medications, or the number of people's lives that are saved and who are cured because of medications, or the number of people with chronic medical conditions that are effectively managed by medications, or the increase in healthcare costs because patients aren't treated with medications and then they require other costlier medical interventions. In the same vein, you can't understand the real costs by only looking at the debit side of the ledger. You also have to look at the credits as well. And with medicines, credits are substantial. We know from IMS data that brand drug, roughly 80% of the cost of brand drug price increases last year were offset by rebates and discounts and other concessions made by our members. I see we're running low on time, so we'll just say that we believe this bill deserves your no vote.
Peter Kellison on behalf of the Generic Pharmaceutical Association. We have a slightly different place in the supply chain than the other opponents to the bill. Our position on the bill is oppose unless amended. We have attempted to work in good faith, and I want to thank the Senator and the sponsors for making amendments to the bill that have attempted to address the unique concerns of the generic industry. Unfortunately, these amendments, while still working toward that, do not get there, and the generic industry must still be in opposition to the bill. Very briefly, the reason of the opposition and why the uniqueness is that unlike other manufacturers in multiple generic manufacturers have multiple manufacturers, they do not set a price so much as they respond to the market price or what the market will pay. Their prices fluctuate up and down and are not on a static baseline level. So we would be required to notify repeatedly, even if we are the next day possibly decreasing our prices. So we have a compliance problem with the bill. We cannot comply with a prospective notification. We must respectfully oppose the bill.
Thank you. Further witnesses in opposition, name and organization only, please.
Jennifer Snyder on behalf of the Biotechnology Innovation Organization in opposition.
Jimmy Jackson, Biocom, in opposition.
Bill Remack on behalf of the California Hepatitis C Task Force in opposition.
Nicole Rice, California Manufacturers and Technology Association in opposition.
Jerry Jaffe, representing the California Chronic Care Coalition. We're in a third category of concerns, and we need to analyze the amendments proposed this afternoon to see if they resolve our concerns or not.
Thank you. Further witnesses in opposition? Seeing none. Questions or comments from the committee? Seeing Mr. Nazarian.
Thank you, first and foremost, very much for bringing this bill, and thank you for the work you're doing on this both overdue as well as very important area of potential cost driver of overall health care. But as I got to delve deeper and deeper into the issue, just had a few questions. First of all, every industry seems to have a marketplace created, and that's helped shaped by federal laws that are passed, whatever state laws are passed, and that kind of creates a quirky mechanism. Sometimes we don't even know half of what happens in that industry or marketplace. And this is an arena where I've gotten to know a little bit as I've been serving on health committee. I did not know of the existence of PBMs before. And when we talk about cost drivers, I'm trying to figure out here, why aren't we looking at the pharmacy benefit managers? I thank you for including them in some of the amendments, but if we were going to make transparency a number one issue, I would think that first identify all the players involved and their actions in the marketplace so that we have a better handle of knowing what the cost drivers are. We can put all the conditions we want on pharmaceuticals, on health plans, but if we let open certain loose ends, we still won't have the full picture. We don't even know what discounts are absorbed by the PBMs in all the negotiation and what gets passed on to consumers, what doesn't get passed on to consumers. So what I'm interested to know is, why not just start off first by regulating PBMs and putting a little bit of a spotlight on that arena, bringing them under the jurisdiction of the state through some kind of a licensing mechanism, and then be able to have a better control of the costs and pricing as we move forward.